Welcome back. Well, it's that time of the year when children seem to pick up every bug and cold going, so how do you keep them protected?
Well, paediatrician Dr. Ranj is here with a kids' winter health alert, and we're starting by looking at bronchiolitis.
Around 1 in 3 children in the UK develop bronchiolitis in their first year of life. Bronchiolitis is a common chest infection, usually caused by a virus called RSV. It's spread through close contact and via tiny droplets of liquid from the coughs or sneezes of someone who's infected. It causes the small airways in the lungs to become inflamed and clogged up with debris. This makes it harder for air to move in and out, making it more difficult to breathe. The early symptoms are similar to those of a cold, such as a runny nose and mild fever, but as it develops, it can include wheezing, a raspy cough and difficulty feeding. There's no medication to treat bronchiolitis, but in most cases the illness isn't serious and the infection clears up within 2 weeks. Fortunately, most children can be cared for at home in the same way that you'd manage a cold. However, it's important to get medical advice if your child is very unwell or has significant difficulties breathing and feeding.
You're saying that in a child, you can actually see them struggling, where you wouldn't see it in an adult.
That's the thing, because children's bones are still soft, they're not completely what we call ossified or hardened. When a child works hard to breathe, often they will suck in part of their chest wall as well. So that's one of the signs you need to look out for a kid that's having significant difficulty breathing.
But contact your GP or midwife if your child is only able to if they're struggling to breathe.
Yeah, definitely. If they've got significant difficulties breathing, if they're feeding less than 50% of their normal amount, or if you're worried that they're just getting more and more unwell, you should speak to someone.
OK, let's talk about this new children's flu vaccination that's available. Not an injection, this is a spray.
It's a nasal spray. So, as we know, flu is really, really common, especially this time of year. In the vast majority of people, it usually doesn't cause any significant problems. But we need to remember that it can have serious complications, especially in those that have got underlying medical problems.
Yeah.
So up until now, because we don't have a treatment, prevention really is the key. So it's all about having a healthy diet and lifestyle, looking after yourself, but not just that, hygiene measures, so, you know, using tissues, washing your hands, being careful around those that have got the infection, and the injectable flu vaccine up until this point. But from September of this year, all children will be, from the ages of 2 to at least 16, will be offered a nasal spray flu vaccine. It looks like this. It comes in a little syringe. There's no needles, which is fantastic. And basically all that happens, if I show you here, it's got a little nozzle on the end of it that goes inside the nostril, just inside the nostril, one on each side, and
does the whole
it just
lot
does
go
a spray.
there?
Yeah, there's 2 doses per syringe. And it's just like a nose spray that you would have, say, if you had hay fever.
It looks like there's quite a lot in there.
There's a bit extra in this one just for demonstration purposes. So this isn't the real thing.
So is it
this
one
is just
squirt
a demo.
up each nostril?
One squirt up each nostril, and that has to happen every year. Because the flu virus changes every year, we have to keep up, and the vaccine is adapted every year.
That sounds like a brilliant idea.
It's actually more effective than the injectable vaccine, but like any vaccine, nothing is 100% effective. You still have to do all those other measures.
You can tell we like it because we've leaned right in.
We have. You're right. You're right.
This is just water, fortunately, so it's not going to... It's not going to protect anyone.
Trying to breathe it in.
But that's just for kids, but will there be ones for adults as well?
Unfortunately, it's not as effective in adults, which is why it's not recommended. So at the moment, it's probably just going to be until the age of 16.
Measles is on the increase in certain areas of the country.
It is. One of these things is we've had several outbreaks of measles around the country, and it's all related to immunisation rates. Since the 1990s, we saw a massive drop because of controversy around a certain study which was disproved and discredited, and the person was, you know, sacked by the GMC anyway. But rates have been going up, but they need to be above 95% for us to get enough protection for the whole population, and we've got pockets where it's not, and we're getting outbreaks. Now, measles is a highly contagious illness. It starts with symptoms of cold, runny nose, temperature, and then you get this sort of reddy-brown spotty rash. Usually starts around the ears, behind the neck, on the face, and then rapidly spreads down over a couple of days. Thing with measles is, yes, most people will be fine if they have it, but it's highly contagious, so you have to be careful around people who aren't vaccinated. and it can lead to serious complications. The best form of protection is vaccination, and that's the MMR vaccination.
Right.
And that's why we encourage
Are
people to have it.
still concerned about that, even
They
now?
are.
Probably without knowing why now, because it's been such an amount of time.
Unfortunately, there has been so much hype and controversy around the vaccine that it's really difficult to do away with that. But rates are gradually improving, and on the back of these outbreaks, you know, health authorities are recommending people get vaccinated.
So when you say it has consequences, what are the consequences?
Well, measles can lead to complications such as pneumonia. That can put you in hospital. You can get infections in other areas, like ear infections, but it can actually lead to brain and nervous system damage.
Really?
So measles, the illness itself, even if you've got over it, in the future you can develop a rare form of it's a neurological disorder called SSPE, and that can be fatal. People don't know that because we've forgotten that can happen.
Yeah.
Experts say that one child with measles sitting in a classroom for just 1 hour can pass it on to at least 70% of the other pupils who are not vaccinated.
Exactly, it's that contagious. And like I said, although the majority might be fine, it can have significant consequences.
What about chickenpox, things like that, for example?
Chickenpox, really common this time of year. Lots of kids will have it. And
my daughter today woke up covered in chickenpox.
That's the thing. This is a different kind of rash. It starts as these sort of red pimples. They're quite itchy, that's the clue, and then they develop into blisters, so vesicles we call them, and then they scab over.
And that's when it's all right?
Yeah, so usually you're infectious until the point that all of the scabs have healed over. So once they've scabbed over, you're still at risk of passing it on to other people. People still go to hospital with chickenpox and go to A&E with chickenpox because they're worried about it. In the vast majority of kids, they're fine as long as you can manage them at home with things like paracetamol paracetamol is what we recommend, encouraging them to eat and drink as much as possible. And if the rash looks like it's getting infected, so if it looks red, swollen or weepy, then you should see someone because you're probably going to need antibiotics. Antibiotics don't work against chickenpox because it's a virus. And the other thing I would say is if you've got a small baby who's developing signs of chickenpox... So
just clarify that, the antibiotics don't work against
chickenpox. They don't work against the chickenpox.
They would work against the infection.
Yes, so you can get
bacterial.
a secondary infection,
Yeah,
so a bug hijacks those lesions that you get.
Yeah.
But if you've got a baby that's developing chickenpox, get some medical advice as well.
We should just mention meningitis, which is such a scary one.
We should do. Meningitis is that illness that basically can occur any time of year. You do get peaks in the winter as well. Starts off with a general illness type picture, so you can have, you know, cold type symptoms and fever, and then some people develop this rash. Now, what we need to be clear about is meningitis is inflammation of the lining of the brain and spinal cords, the meninges, and that gives you the neck stiffness, the headaches, the fever, the vomiting. In older kids, smaller kids might just be drowsy, not feeding very well, irritable. If that germ that causes that gets into the bloodstream, it causes blood poisoning, or meningococcal septicemia is the term. And that is what gives you the rash. So you can have meningitis without having this rash. That's the important message. This rash only happens when you've got the blood poisoning type, or the septicemia. And classically, it starts off red, blotchy, purple patches, spreads very quickly. So if you've got a child who's unwell with a temperature and this kind of rash, go and see someone. And we say, do the glass test. Now, rashes that aren't meningitis or meningococcal rashes tend to fade when you press on them. So you use a standard glass to do it. I've drawn some spots on my hand there. This is not the meningococcal rash, but it's just to illustrate. When you roll the glass over it, it doesn't fade.
So it'll stay there.
Other viral rashes tend to fade, but meningococcal septicemia, which is a bacterial condition, does not fade, and it's a medical emergency.
Okay. Thank you very much.
Thank you very much
Thank
indeed.
you.
We should. Well, let's lighten the mood a little bit, because you have got there's a little video here about rashes and itches. Done for kids.
It is. This one's about ringworm.
Oh, lovely. Oh, lovely. Christmas number one.
Joy.
Don't itch it, don't scratch it, though you want to very much. Or you might give the itchy germ to everyone you touch. Don't itch it, don't scratch it, though you want to very much. Or you might give the itchy germ to everyone you touch. Itch, 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 I know I must.
Very good. There we are. You see?
Love it.
It's a contender.
Thank you very much. Thank you.
Thank you.
Right, you can find details of everything we just discussed with Dr. Ranj on our website.
And still to come, he's back with a bang, and one very surprised viewer, Michelle, thought she was coming for a day out in London. Now she's the star of Gino's Kitchen Kidnap. Next.